Another factor that can increase chances of getting a heart attack is being overweight. There is a certain amount of weight which is okay for your given height. If your weight is more than that, then you are overweight, and then there are ranges of being overweight. It is mildly overweight, moderately overweight, and severely overweight, which is also called obese. If you are overweight, you should try to decrease weight, because decreasing weight decreases chances of you getting a heart attack. We have 3-hour presentation on diet, exercise and weight management. Please feel free to watch that one. Now let's look at the weight for height tables. These tables indicate your expected maximum weight for your given height. Let me explain what I mean by that. Suppose you are 5 foot 6 inches tall. That means you are 66 inches tall or 168 centimeters tall, and all these numbers are there in the table. So whatever way you know your height, you check that row. If you are in that row that you are 5 foot 6 inches or 66 inches or 168 centimeters, then your maximum weight, which is considered as a normal weight, should be below 155 pounds or 70 kilogram. You see, when you look at tables in various other places, they talk about mild overweight, moderate overweight, severe overweight and obesity. I believe personally that's a very good concept from the doctor's point of view, that he can think of how much of a risk you have and how aggressively you need to be treated for that weight problem. But from a patient's point of view, that sort of classification, in my view, causes complacency, causes patient to think that I am only mildly overweight. I will try to control when I am moderately overweight or severely overweight. I am fine because I am only mildly overweight. There is nothing like mildly overweight. There is overweight or there is no overweight. Because when you are mildly overweight, by that definition of mildly overweight, you have the best possibility of coming back to the normal weight, which is below 155 pounds in this case, or below 70 kilogram in this case. Once you become severely overweight, it is so difficult to lose weight. Once you become obese, it is so difficult to lose weight. So that classification of mild overweight, moderate overweight and severe overweight, I don't much like it from patient's point of view. So this limit of weight corresponds with a BMI or body mass index of 25, which is the upper limit of normal for your given weight and for your given height. So any weight which is shown in these columns, any weight more than that, start thinking of reducing it to come back to the normal range. Just remember one more thing, that some people who exercise a lot may have overweight, but that overweight may not be a harmful overweight. They may have good amount of muscles in their body. So if you exercise a lot and your weight is more, then there is no need to reduce it, unless you are fat because you have apple type of obesity and all those things we talked about. But use this table as a guide to see what your maximum expected weight is and try to achieve to go below that range. When we talk about weight, there are two types of body builds that are spoken of. One is called the apple-shaped body and the other is called the pear-shaped body. You see, what happens when you look at a middle-aged man from the side, you will see that his belly is like little out. As men grow older, after the age of 40-45, the belly starts coming out. This belly comes out because there is a deposit of fat inside the belly, and this fat is very dangerous because it increases chances of diabetes, heart attack, and because this fat deposits in the abdomen, it gives the appearance of an apple when looked from the side. Means the shape of the man's belly will look like as if there is a big apple there. compare this to another person who does not have a lot of fat in the belly, but has strong muscles, which includes the hip muscles. So when the person is sitting from behind, if you see, it will appear like a pear. Bigger bottom, narrower waist. Many women, their body appearance or body shape is like that, especially when they are younger, and this is to give an idea as to what is the difference between an apple-shaped body and a pear-shaped body. A pear-shaped body is much better because it decreases the chances of a heart attack. So if you have an apple-shaped body, like your belly is bigger, then you should do physical activity as per your doctor's advice, that you can decrease this belly, because decreasing this belly will get rid of a lot of, I will call, toxic fat from your abdomen. This is about the shape of the belly. Remember, some people who exercise a lot can have more weight, but you have to differentiate that by the history, that if a person exercises a lot, they will have a lot of muscle, they can still be overweight but healthy. Another important factor that predisposes a patient to a heart attack is decreased physical activity. See, many hundreds of years ago, we were physically very active. As we have become more industrialized, we first got bicycle, then scooter and motorcycle, now cars. Now the situation is that we hardly walk. We come out of our house, sit in the car, go to work. The parking is almost in the same building. We take an elevator, go to work, and the same thing is repeated when we come back home. So there is no walking, no exercise involved. Lack of physical activity significantly increases chances of getting a heart attack. If you start doing some activity, your chances will start decreasing, and it is recommended that you should exercise for 150 minutes every week. So if you exercise, say, for 30 minutes a day for 5 days a week, that will make it 150 minutes. Remember, before you start any exercise, you have to talk to your doctor. Even before you start walking, you have to talk to your doctor. The reason is, your doctor may be able to recommend you, suppose you have diabetes, then he will tell you what is the right footwear, what are the best surroundings to walk in, what will not be good, like weight bearing exercises are not good for people who have eye problems. So there are so many small things involved. You can watch our presentation on exercise and how to stay healthy, which will give you broad guidelines of what exercises to do, when, and what are the possible problems that can happen. A simple plan can start with, say, walking 10 to 15 minutes, and then gradually building up on that you walk 30 minutes, 45 minutes, an hour, then you walk briskly, and then you start like jogging and walking. So all this can take up to 3 to 6 months that you come into a proper mode of exercising. Another good way to exercise, even though it is not really a very aggressive exercise, is yoga. It's a very mild exercise. It is mostly stretching exercises. The exact role how yoga works in decreasing stress, and therefore all the problems related to stress, and is not known, but it definitely helps. So give it a try, learn from a good teacher, ask your doctor what exercises you should avoid, and then work with your trainer to learn yoga and practice it every day on a regular basis. As I mentioned, walking, even a little walk, is good for your health. So it may be working in many different ways by increasing the sensitivity. Exercise works in many ways. Of course, it increases metabolism, it decreases cortisol levels, it decreases blood sugar levels, it decreases weight, it decreases the bad cholesterol LDL, it increases the good cholesterol HDL, and there may be many more factors. It gives a good night's sleep, causes better relaxation. So all these things come with exercise. So exercise is very important, but be careful, do it with your doctor's consent and with his approval. Avoid jumping on very heavy exercise. Talk to your doctor. If you go to a health club, talk to the trainer. A good trainer should be able to guide you through the maze of so many millions of exercises into the ones which will benefit you the most and will be safe for you and will not cause any harm to your body. We talked about stress. Stress increases cortisol levels. Cortisol increases abdominal fat. Cortisol increases blood pressure. Cortisol increases weight. Stress causes anxiety, causes palpitation through a release of some chemicals in the body called adrenaline, noradrenaline, etc. So stress hurts in many ways. You can't sleep well if there is stress. So learn to de-stress. Now, whatever your stress level in life is, try to decrease that and go towards the baseline, especially if you are a high stress person or if you are in a high stress job. Now, stress can be reduced in many ways. It's not easy, but if you are committed to reducing stress, there are many approaches you can use. One is yoga, we talked about it. The other is exercise, we talked about it. The third is sex, we talked about it. The fourth is meditation. It helps through calming your nerves. Then you can also get a psychotherapist's help because psychotherapist will help you behavior modification and tell you how not to react to certain situations that you don't end up hurting yourself. How to modify your response to a given situation. The situation will remain the same, it will not change. The only thing that will change will be your response, and that will de-stress you, that will decrease the stress from your body, and that will help you decrease your chances of getting a heart attack. A word about middle vessel disease. We have talked about this in so many other presentations. Our body has three types of vessels: the major ones or the large ones, which are more than an inch in diameter; the small ones, they are very small, smaller than a millimeter in size, in diameter; and then middle-sized ones. And middle-sized ones are 3 to 5 millimeter in diameter. They supply most of the important organs. It's like pipeline. The city gets its water with a very big pipeline. By the time it comes to your house, it has decreased a lot in size, and in between those two are different size of pipelines. So medium-sized vessels are blood carrying vessels which are 3 to 5 millimeter in size. They supply many important organs in the body, like brain, like heart, like penis, like legs. And these middle-sized vessels can be easily damaged by smoking, by high blood pressure, by high cholesterol, by diabetes. All these things make them much harder, and that leads to decreased circulation. And there's a full presentation, we have an hour long on middle vessel disease. But remember, middle vessel disease is a common factor that binds together heart attack, stroke, peripheral arterial disease, impotence, because these all structures are supplied by middle vessel